Some good news amid the doom and gloom of Covid-19. The United States appears to be emerging from its latest wave. According to the official data presented by the CDC, a 7-day average of new cases has now peaked around 750,000. The decline is being seen in states that were first hit by the wave, like New York, New Jersey and Maryland. But officials have called for caution because in states like New Mexico, Arizona and Utah, and even other states, cases continue to rise. A similar trend could be seen in other countries battling the Omicron wave. A steep rise in cases is seen to be short-lived, and soon the graph is showing a downward trend. Though Omicron is showing mild effect to some people, experts around the world are now urging everyone to not take this variant lightly. But the future seems to be hopeful. Experts, including the top infectious diseases expert, Dr. Anthony Fauci, are expecting the virus to enter the endemic stage, which is when a virus is more prevalent but less severe. This would mean that eventually we will live with the virus. Like malaria, it will cause mild to moderate disease in most vaccinated people, but with treatments, the infection can then be taken care of. However, there is no guarantee. These are all possibilities being discussed and floated at the moment. It is not certain what trajectory this pandemic will take going forward. Now, for more on this, our correspondent Susan Teherani joins us live from New York. Susan, thanks so much for joining us. Now, data seems to suggest that Omicron cases have peaked in the United States, yet hospitalizations are at their peak as of now. So what is the true picture on ground?
Different pictures in different places across the United States, as you mentioned. For example, in some northeastern states here in New York, Rhode Island, Massachusetts, we are seeing a decrease in the number of cases. Again, in some parts, for example, in New York City even, the numbers are different. We saw less than 28,000 cases in New York City, for example, on January 16th. Just to give you a picture of how different that was compared to January 9th. On January 9th, there were 40,000 cases. However, a nurse at a hospital in the Bronx, which is sometimes called the quote-unquote forgotten barrows because of its economic disparities, said that patients are lying in hallways on stretchers that are touching each other. Those are places where President Joe Biden had said that he would perhaps send military emergency forces. So those are places that still those plans are in place. However, cases, again, in some parts of New York are coming lower. As you mentioned, for example, the U.S. Surgeon General also said that the issue that we are having here in the United States is that, Omicron isn't decreasing or increasing at the same pace all over the country. But for the most part, yes, there is that kind of glimmer of hope that for most individuals, despite the fact for it to be highly transmissible, it has sort of been like a flu. On the other hand, the cases continue to rise among the quote-unquote unvaccinated, and that is an issue that is highly debatable here in the United States.
Now, Susan, given these trends, can we expect a change in mask mandates or even restrictions and more in the United States as of now? As we know, the United Kingdom, on the other hand, has ended most of its COVID curves after reporting a peak in cases. Can we expect the same in the United States going forward?
Well, what's interesting is President Joe Biden recently pointed and signaled that he wants to send he already started launching a website to send rapid home tests to American families, but he also signaled that he wants to send masks to American families as well. One of the issues that the CDC has been having and the criticism that it's been facing has been regarding its messaging, not only regarding masks and what kind of masks work, whether or not masks work, N95s, cloth masks, regular masks, so on and so forth, but also, regarding isolation periods as well. So, we'll have to wait and see what the guidelines are, but I think one of the issues that the United States has been having throughout the pandemic has been, A, the politicization of the messaging, and B, the CDC guidelines really have not been persistent and consistent, and Americans have often been left confused. And that's something that the CDC has been admitting to. So until and unless we really get everyone on the same page, I'm not sure if we'll get a concrete answer on masks, and I'm not sure whether or not the American public will go along with those guidelines or not, and everyone won't be doing what they want to be doing as they have been during the pandemic as well.
Right, Susan Teherani, thanks so much for joining us from New York on WION at this hour, and thanks for all those inputs. WION World is now available in your country. Download the app now and get all the news updates on the move.